the Facebook, YouTube wasn't working. And God forbid if we denied the myriad of followers on those platforms, honestly, all hell would break loose. So, for goodness sake, we have to involve the YouTube and the Facebook community. So, yeah. So there we are. There. Are you all in there now? How many are there? Right. Okay. Well, maybe it's a bit early. Maybe I haven't started coming yet. Anyway, so we've got Q's and A's, and I'm here for you. If you have a burning Q, or even if it's not a burning Q, to be honest with you, any Q will do, preferably plastic surgery related, and I will do my level best to provide the A's. So I'm going to kick off with if there isn't anyone out there who's got anything better to say. So I am going to say this. This is what I'm going to say. Do you offer a mini arm lift, or is it only a full arm lifts? So yeah, I mean, I guess this comes to where I kind of had up a clinic, and there's other surgeons, and that we've all got our own thing, you know, views about things, and all plastic surgeons have got views about things. So I'm just going to tell you my view, because people will have different views. And my personal view about mini arm lifts is that I don't do them because I don't think they are very good. No, I shouldn't say that. I don't think I can't get very good results with them. That's the way to say it. And it's a bit like someone asked on YouTube this morning, I think it was, about, or at least I answered it this morning, they might have asked ages ago, about having a circumareolar lift, breast lift. So all these kind of mini scar things, circumareolar breast lifts, mini arm lifts, mini thigh lifts. So all these sort of minimally invasive surgeries sound great. And I can understand as a patient, you might think that's great. I haven't got much of a problem. I'll just have a mini, whatever it is, arm lift. But as a surgeon, I have found it hard to give a significant lift with a mini arm lift. And the main difference between a mini arm lift and a full arm lift is a full arm lift, the scar goes all the way down to the elbow. It goes all the way down to the elbow. And a mini arm lift is up in the armpit. It's hidden in the armpit. So the mini armpit mini lift, arm lift, is really well hidden. Short sleeve shirts and all sorts. So it's really well hidden. Whereas the full arm lift is visible in short sleeve shirts and is quite a thing to take on. And sometimes, you know, I say to patients, if they are worried about people seeing their arms now, I might give them a scar, which will give them a different reason to be worried about, you know, showing their arms. So it can convert one problem to another problem, which isn't great. So it is not a common procedure, and I don't try and kind of push it. But at the same time, I don't offer mini arm lifts simply because I can't get great results with them. They're still a surgical procedure. Yes, they're less than a full arm lift, but there's still an operating theatre, there's theatre teams involved, and there's time in theatre involved. Therefore, there's still costs involved. And the problem is the costs are quite a lot. The costs aren't that much less than a full arm lift. And in my hands, the results are quite a lot less. So that's the problem. That's why I don't do them anymore. Because it's a recipe, in my view, for unhappy patients. If you charge a lot of money and give a subtle result, you're running into potential for difficulty. I think if it was a lot cheaper, then there'd be an argument for it. But the fact that it's actually quite expensive and it's also got risks. Obviously, there is a scar there. The scar may not be as visible, but there's risk of the scar not healing up so well because it's kind of hidden up in the armpit. You can have complications in terms of the scar opening up and getting infected and what have you, and taking time to heal. So there's all sorts of issues that you can potentially get, and that, along with a subtle result, is a difficult thing to do to people, and therefore I don't do it. I think people do it, and maybe I don't know, maybe they've got it worked out better than I have. I wouldn't be at all surprised. So it is a thing. Oh God. So okay. I think what's happened in the past when that's happened is that audio's gone off the Instagram, I think. Can you still hear me? I think, anyway, I don't know how to say it. I think yeah, someone's just phoned me. What time is it? 7:15. What on earth are they phoning me about at this time of night for? Anyway, was I talking about minimal arm lift, wasn't I? Yeah, so that's it, I think. Had I finished? Minimal arm lift is less. New voicemail, God. Minimal arm lift is less than a full. Yeah, and I don't do it because I get minimal results. And as I said, there's some people who worked it out. So I think people do offer it, and so I wouldn't say it's a kind of bad thing to do. I don't think it's a bad thing to do. I think it's an okay thing to do, but I think it's just, for me anyway, it's having a good discussion with the patient that they're going to get subtle results and risk of complications, and maybe some people, as I say, have got that worked out and do that. But in my life, it's not something I do in my life. So what the next question? I'll hear you say. Willow just got the number 2 gifter badge. Well done, Willow. Thank you for that. Gifting. Don't know what you are gifting. Do I get a gift? That's the TikTok. TikTok's doing well. Who knew? TikTok's a platform to be. Is that view? What's that like? Are there more? Oh, here we go. Another mini arm. We're not off mini arm lifts yet. Are there more risks for a mini arm lift? I wouldn't say there's more risks. No, I think if anything, there's less risks, because when I do a full arm lift, I do like an L shape incision that goes down and then L into the armpit. So there's that. So a full arm lift has got the same incision as a mini arm lift, but more. So no, I would say it's got less risks. Well, unless you count being dissatisfied with the surgery a risk, in which case it has got more risks. But that's not generally classed as a risk. I think you're talking more about wound problems. So no, I'd say it's got less risk because you remove less skin. Because the problem is you're pulling it in an up-down direction with a mini arm lift. Putting it like that, you need to be putting it side to side. So side to side means a scar down here. Mini arm lift is less. Or if you do a short scar where you finish it, there's going to be a bulge. So you've got to. Well, personally, I think you've got to contour it all the way down to the armpit, which means scar all the way down to the armpit, which means visible scar, etc. Not for everybody. Another arm lift. Yes, here we go. Do you preform? God, I think we were light on questions tonight. I think this is probably one person, and we made 3. Anyway, Amy, well done for making 3 questions out of presumably 1. I can't believe 3 people have asked mini arm lift questions, but we've got a mini arm. Yeah, let's go with the vein. Tonight's show is dedicated to mini arm lifts. Do you preform many arm lifts? No, I don't. And I get that, and you're probably thinking, yeah, I know why. The fella's not exactly keen. Absolutely right. It's not that I'm not keen. I don't mind doing the surgery. I'm just not keen on patients who are unhappy with the results. And the problem, even with a full arm lift, as I say, is it's a long scar. So I make that clear to everyone. I show them photos of the scar. Try our best to hide it, but if you put your arm up in the air, the scar is visible. So it's not to be taken on lightly, and therefore I don't perform many arm lifts. I don't think many of us do. I don't know. I mean, there's obviously probably some plastic surgeons who sort of specialize in weight loss patients. They will be doing them obviously more. That's where it really comes in. The weight loss patients where there's functional problems as well as the cosmetic problems of the excess skin of the arm. So if you really, that's where it comes in. There are some patients where you're, oh yeah, look, there's a lot of skin there. I can really make this better. And they're really good candidates. The patient who just feels like they've got a bit of, bit of sort of flabby arms and just feel that they want it tightened a bit is not a great candidate for an arm lift in my hands, but they, as I say, they might be in other people's hands. So yes, that's why I don't perform many arm lifts at all, many or none. Well, I don't do many, so just arms, many arm lifts. I don't perform many arm lifts. Easy for me to say. Okay, come on, let's get off the arm lifts. Let's get on to something better. Yes, Obagi. Let's talk about Obagi. Do we offer Obagi treatment? Yes. What a good question. No, we don't offer Obagi treatments. So Obagi, we used to have Lucia Verades who did it at the clinic. Going back a bit now, years ago that is. So we used to have a doctor who would do that. It's a doctor prescribed treatment, and it's kind of like a chemical peel for your face, and I think it's a very good thing because it's kind of like I think you can get, this is out of my area now, I'm talking about things I don't know much about, but I think you can kind of get chemical peels things, can you, maybe sort of off the shelf, and then there's sort of like a chemical peel that we would do in sort of surgery, and I think this is somewhere in between. It's kind of monitored by a doctor, but it's kind of something that you kind of do as an outpatient. And I think it's quite a good thing, the Obagi treatment, from what I can tell, but I haven't got a huge amount of experience, any, to be frank. I've got no experience in it. I kind of know what it is, but I've got no experience in it. So perhaps I shouldn't really be talking too much about it. Well, or you asked. I mean, what do you want me to do? I can't not answer. All right, so we'll move on. All right, so I don't do Obagi. Sorry about that. Do we offer surgery for tubular breasts? Tubular breasts, tuberous breasts? Yes, we do. We do surgery for tubular breasts. It's a difficult problem to fix, a tuberous breast. Well, first thing to say, there's quite a spectrum. I saw someone the other day who had been, I think they'd been told, or maybe they'd self-diagnosed as a tuberous breast deformity, but they didn't actually have a tuberous breast deformity. I think people think they've got it more than they have, if that makes sense. I think a lot of people think they've got it when they haven't. Or in my view anyway, what I would call a tuberous breast deformity, to be honest with you, it's slightly academic what you call it, because you might be going, what's a tuberous breast deformity? And I'm like, don't worry about it. If you are not happy with the shape of your breast, put it like that, then we can help, whatever. A tuberous breast deformity is a type of breast abnormality where the base of the breast is constricted. The nipple areola complex is often very large and herniated. There's often deficiency in breast tissue in the lower pole below the nipple. So it's a specific kind of look. But sometimes patients who just got a breast sitting a bit low, who maybe just need a breast lift or maybe need implants to add some volume, think they've got a tuberous breast deformity, and I wouldn't say they have, but at the end of the day, it kind of doesn't matter. If you're not happy with the shape of your breasts, then we might be able to help, whether it be with lifts or doing things to the areola or implants or combination. It's often a combination for a full-on tuberous breast deformity. It's often a combination of procedures, not always, but often. And even if when you don't do a combination, even if you do something like a breast augmentation, it's often more difficult. You have to do scoring of the lower pole to try and make the lower pole expand out because the lower pole is constricted. So it's a difficult problem to fix, but it is something that we do at the clinic. Can you remove accessory breast tissue under local anaesthetic? Yes, you can. I'm going to do one of those annoying it depends type answers because I did one at the clinic, not, well, I don't know, it was probably quite a while ago, but anyway, by excision. So what we would do at the clinic, we would do it by excision, because what we do at the clinic is local anaesthetic procedures. And when you have accessory breast tissue, which is basically breast tissue in your armpit, here is a fold in your armpit, the options for treatment are excision or liposuction. They've both got benefits. Liposuction, the benefit is the scarring is very small, hardly noticeable, which is great, but it doesn't remove any skin. And so if you liposuck it, if there's a large sort of bulge there, you would worry there might be some redundant skin. And liposuction, I don't do at the clinic, I do in the hospital. So if we was doing liposuction, then I would do it at the hospital. Excision does remove skin. So if there's a sort of large skin component to it, if the skin's been stretched quite a lot, then excision will remove that skin, but will leave a scar. Now, we aim to hide the scar in the armpit, but often the bulge is coming in front of the armpit. So there's a balance to where we put the scar, because we're going to try and put the scar back into the armpit, but then we're not removing any skin from in front of that where the scar is. That can leave some sort of baggy skin in that area. So there's a balance as to how far forward we put the scar if we're doing an excision. So this is a discussion to be had. Perhaps not on this Q&A. Perhaps that's in the clinic. Maybe I'm going outside the remit of this. So the question is, do you remove accessory breast tissue under local anaesthetic? The answer is sometimes. Yeah, should we leave it at that? Sometimes we do, when it's excision, not liposuction. Don't know, not sure how much detail to go into, because I'm sure that's probably not relevant to a vast number of people, but maybe there is someone out there who is relevant to, and if so, well then hopefully that answer has gone some way to well, probably all the way to answering the question, because it's quite clear in my mind anyway. Yeah, when we excise it we can, as long as it's not massive. When we do liposuction we can't. Now, that's it for my questions. I will answer any questions that come up, but I have to warn you, I have got some chicken steaks in the oven, and I think they were 25 minutes. So I am under the clock, shall we say. But I will, well, I'm just going to say, yeah, I'm just going to say I'm busy in that case. I'm busy, and I thank you all for your input. There are people on the Facebook and the YouTube, which is good. Can't really tell which. And as ever, you got the loyal, staunch support on the gram, and the new pretender of TikTok. Big up yourself, TikTok. Thank you for being here. But yeah, without further ado, I'm going to go and get the chicken steaks out of the oven, and hopefully I'm doing risotto as well. So I just poured loads of fluid in, and hope that I've done it for a while now. Just last bit, I just poured a load in, so hopefully it hasn't dried out and all ruined. But anyway, enough of my yapping. I'm going to stop the stream and